Hi, everyone. We are very excited to present to you a symposium on chronic hand eczema. This program is supported in part by an educational grant from Leo Pharma, for which we are very grateful. So just few words about the International Eczema Council. It was founded in late 2014, and it's a global non-for-profit organization that is led by dermatology experts on atopic dermatitis. It's governed by a 13-person board of directors, and currently we have 107 counselors and associates from 24 countries that serve as expert advisors to the IEC, and we are still growing. We have many successful symposia and virtual educational programs, including in the last year, the 2020 EADV on novel systemic treatments for atopic dermatitis and clinical trial design, new treatments for atopic dermatitis in infants and children, management of atopic dermatitis patients on systemic treatments during COVID. In 2019, World Congress of Dermatology with new topical treatments and preventing mechanisms. At the SID in 2019, a symposium on barrier. At the 2019 American Academy of Dermatology, we had a very successful meeting on atopic dermatitis and alopecia areata, contrast and compare, a microbiome, and the 2018 AAD. At the ISDS, we had atopic dermatitis phenotypes and biomarkers, and many other very successful symposia. We have some future educational programs at the SID. We will have a symposium on biomarkers, and we recently had a very interesting a paper on biomarkers, a review paper published in Journal of Allergy and Clinical Immunology. We are going to have a program at the ESDR on human models of atopic dermatitis. And we are going to have a program at the World Congress for Pediatric Dermatology, as well as one at the ADV on face and sensitive areas, and at the Inflammatory Skin Disease Summit in 2021 in New York City. Again, we are coming back to alopecia areata and atopic dermatitis. So very exciting time for us. As I alluded to, we published several papers, including the recent review on biomarkers, and also the recent paper on chronic hand eczema, that is the topic today, but also several other papers on conjunctivitis with and without dupilumab, and also the role of bacterial skin infections in atopic dermatitis. And we have several others that are in progress now. Some of them actually accepted already or published, such as the atopic dermatitis biomarkers and several others. So very exciting time and busy time for us. You can look at the top 10 publications that we are posting every year on the IEC website, both for 2019 and for 2020 that is coming up. In terms of our disclosures, we are really grateful to the partnership with multiple pharma companies that without them, all the advances that are happening now would not have happened. We view this collaboration as really essential to bring new drugs for our patients with atopic dermatitis. And we want to thank the companies that are listed here for their partnership with the International Eczema Council. We could not have done what we are doing without you. So thank you so much. So with that, I want to present this virtual symposium on chronic hand eczema. The program chairs are Robert Bissonnette, that is actually the president-elect of the International Eczema Council, Tove Agner, that is a counselor from Denmark, and David Cohen, that is also an IEC counselor from the US. In fact, he's my colleague in New York City. And additional speakers are myself, April Armstrong, also from the United States, from California, and Jonathan Silverberg, also an IEC counselor from the United States, from Washington. And the agenda, the introduction, and we are moving on with a talk on epidemiology, hand eczema, and etiology and classification by Dr. Armstrong. After that, how to run a hand eczema clinic, a very practical consideration by Tove Agner from Denmark. After that will be a talk on allergic contact hand dermatitis, David Cohen. Tools to measure severity of chronic hand eczema, Robert Bissonnet. Current therapeutic strategies, phototherapy and systemic therapy, Jonathan Silverberg, followed by a panel discussion. Thank you so much for your attention.